I do want to make sure we leave enough time for all our questions to be answered. So while I will share information about the panelists, you can find their full biographies in the session details of this event on the virtual attendee hub, back the way you got into the event. From the School of Dentistry, we have Dr. Brandy Richards. Dr. Richards graduated from the VCU College of Humanities and Sciences in 2012 with a bachelor's in science and the School of Dentistry in 2016 and 2018 with her degrees, the DDS degree and an MS concentration or specialization in pediatric dentistry. She's currently a pediatric dentist in Charlotte, North Carolina. So thank you so much for joining us, Dr. Richards. And I had the pleasure to have taught Dr. Richards. So I know we look the same age, but I taught her, okay? Second, from the College of Health Professions, we have Mr. Cliff Porter II. Mr. Porter graduated from the College of Health Professions in 1989 with a bachelor's degree in healthcare management. He now serves as the Senior Vice President of Government Relations for the American Healthcare Association. Thank you for joining us today, Mr. Porter. Next, from the School of Medicine, we have Dr. Eric Freeman. Dr. Freeman graduated from the School of Medicine in 2002 with his MD and now serves as the President and Physician-in-Chief for Old Dominion Pediatrics here in Richmond, Virginia. Thank you for joining us, Dr. Freeman. Next, we have from the School of Nursing, Dr. Audrey Roberson. Dr. Roberson is a double alumna of the School of Nursing. She graduated with her master's in 1992 and her PhD in 2018. She was VCU Medical Center's first COVID-19 vaccine recipient and currently serves as the nurse manager in the medical respiratory ICU here at VCU Health. Welcome and thank you. Last but not least, from the School of Pharmacy, we have Kellyanne Cobb joining us. Dr. Cobb graduated from the VCU College of Humanities and Sciences with a bachelor's degree in biology in 2013 and the School of Pharmacy in 2017. She's currently a pharmacist developing clinical pharmacy programs for Anthem with experience in Medicaid and Medicare pharmacy quality measures. So let's jump in and get started. Welcome and thank you everyone, all of our panelists for being here. Thank you all the attendees for engaging with us this evening. The chat is open. Although we're not taking questions directly, please engage us there as well. So as you perhaps introduce yourself a little bit more, will you please share with us your career path, how you got into your discipline or your field, and what it was like as a student or early practitioner from a diverse background. And so we'll start perhaps with Dr. Roberson there, if that's okay.
Absolutely. Can everyone hear me? Yes. Okay. Well, I actually started my nursing career up in New York. So I'm a graduate, undergraduate. I got my undergraduate degree from NYU in New York and then transferred, or I should say transplanted myself down here to Richmond, went to school, received my master's in nursing, and then in 2018 graduated from the School of Nursing with my PhD in nursing. Along the way, I've had a lot of life lessons. Most of them are at the bedside. So I'm very excited to be here today. And I think the one thing I want to make sure I share with you was growing up in New York, pretty much a melting pot, and going to NYU, truly a melting pot. When I came here to VCU, I didn't feel so much so. At that time, getting my master's and definitely getting my PhD, you can count on less than one hand how many African Americans are getting their PhD in any program, I would imagine. So that was just very different for me as a student, and having to have that experience with a less diverse group of faculty members. And then going into the healthcare field, as I said, I'm a nurse, so started off as a bedside nurse and did that for many, many years. I am now the manager of the medical respiratory ICU at VCU Health System, where we received our first COVID patient over a year ago. And I still experience those challenges where I see a lot of patients that look like me, but they are not necessarily being cared for by people who look like me. So I have a lot to say about that later on this afternoon. Thank you.
Thank you so much for sharing that with us. Does anyone else feel led to address that first question? Perhaps what was your initial experience as a student or early in your years of practice being someone from a diverse background?
Sure, I'll jump in. I think I may be one of the few that actually did my undergraduate degree at what was then MCV in 1989. So in those days, your upper division classes were at MCV. And essentially, we had our classes were usually taken with the MHA students. And you just had, more rigorous requirements if you were in the grad school versus the undergrad as related to reading requirements, et cetera. But at that time, it was not a diverse place. I'll just put it that way. VCU has become a significantly more diverse university over the years. And obviously that's something I'm very, very happy about and proud of and glad to see. But particularly in the 80s, MCV was a pretty lonely place, particularly for African Americans. We had our community usually on the Monroe Park campus. That was kind of where you had some level of community, but even there it was not the most diverse place. So, again, it was interesting. I will say this, the one thing that I will absolutely say is that particularly in the health administration program at the time, there was, particularly in the area that I studied, which was long-term care, just a pretty stiff resistance to diversity. I was one of the early licensed nursing home administrators that were African American in the state. I actually got my license before I graduated. I was the first to do that. And I graduated in 1989. So that just gives you some perspective as it relates to sort of how recent some of these changes have occurred. So again, I'm super pleased to see the progress the university has made. It was very much sort of a health science school. And with that, it was a very, very non-diverse kind of institution and not the most welcoming place at the time. But as we always do, we found our community and made it work and figured out ways to be successful. So I think, again, I'm really proud of the progress the university has made and ultimately where we sit today.
Thank you for that addition. From your perspective as a healthcare provider, what are the challenges you see when caring for underserved populations? I think Dr. Freeman or Dr. Richards would like to start that off.
Yeah, I'll go ahead and start. So I'm a pediatric dentist. So I would say one of the biggest challenges that I see in my practice, I primarily see is Hispanic population, immigrant population, because my boss is from Peru. So I say one of the biggest things I see is that a lot of my patients aren't able to get insurance a lot of times, even like Medicare. And then there's also the biggest thing as far as a language barrier, because I have kids that literally have just come to this country and they 3 and 4 years old don't speak English. So it's very difficult. I've had to learn a lot of Spanish on the fly. So I feel like the language barrier is a big thing. And then even though their children, a lot of my parents, their children may qualify for Medicaid, they don't seek it because they don't want to identify as undocumented citizens or they just want to protect their families. So that's one of the issues that I see serving under an underserved population. I would say also I have a lot of parents that try to do really great things for their children and just have lots of barriers, whether it's transportation, they have to go to work, they have multiple children, that access is just limited to them. So I feel like those are my 2 biggest barriers to care.
Thank you so much for that, Dr. Richards. And I think most of us, would define all of those things as social determinants of health, right? So there are all these things, at least I could speak from a dental perspective, right? Because I've been in private practice before. you may have these stigmas. Oh, okay, I don't want to take Medicaid. Okay, well, why don't you want to take Medicaid? There's these assumptions and okay, the patients aren't appreciative, the patients show up late or all these other things, but no one stops to ask, or very few people stop to ask the questions you just raised. These are hardworking parents that want the best for their kids too, but there are barriers, often systemic, in place that are hurdles they have to overcome. So definitely, thank you for that. How about you, Dr. Freeman, in your treatment of underserved populations?
I can tell you, Dr. Smith, I would piggyback on what Dr. Richards just said. I think, people think that when they come into a dental practice or a pediatric practice, it's all about the immediate care that they receive. But I think many of us in primary medicine and dentistry have to look, again, as we've been talking about, in terms of the social determinants of health. I can tell you my practice is probably about 60 to 65% Medicaid. There are great challenges in terms of making sure that people have access, that have coverage. Again, transportation is always a huge issue for us. I also see a big challenge as we move forward in making sure that we have adequate primary care medical and dental access in the areas that are greatest hit, many times in areas of lower socioeconomic status. There is not a great kind of balance or density of primary care providers. I have challenges every day with food insecurity. A lot of times it's not just about the medical side, but if I don't have a healthy child who gets a healthy breakfast every day, that throws a big wrench into what we can do for care for them. I think, particularly in light of the COVID-19 pandemic, one of the biggest things that we saw over the last year is food security for many of our children. So I think day to day, in terms of access, in terms of finances, in areas of underserved communities, and really making sure that we have, we really wear multiple hats as primary care providers, trying to make sure and ensure that we address the critical social determinants of health for our patients.
Thank you for that. If I may pivot just a little bit off of our script, I would love to know also, we're discussing the barriers, right? But what are some of the rewards of really treating these populations that are underserved and underrepresented in all of our fields? What are the rewards of engaging with these populations?
I mean, I mainly see Medicaid patients as well. It's one office I work in is about 50-50 split, and then between private and Medicaid, the other one is probably more like 70% Medicaid. And I absolutely love it. Like, that population is so much just fun. The parents are just it's just such a grateful population. I love working with their kids. Like, it's such a pleasure, like, all the time. Like, I would say to be able to put my best foot forward for someone every single day, and let them know that they're going to get the best from me, regardless of their insurance. I've had parents ask me, "Oh, you're just you just take Medicaid, like you're just seeing patients, a ton of patients." I've had parents make that comment to me, but I'm like, no, like, every day I put my best foot forward for every patient, regardless of what they pay. So my parents walk away and the kids walk away knowing that I did my absolute best for them.
Dr. Smith, I would piggyback on what Randy just said. I think, I went to med school, and I can't speak for others on the panel, but I went to med school to serve all children, infants, and adolescents. I don't think there was a caveat or an amendment or a codicil in the Hippocratic Oath that said I'm going to take care of a certain strata of patients. I'm very proud to say that the majority of my office, it's 65% Medicaid. I can tell you that my practice is probably almost, I would say, 60 to 65% Hispanic. I have had to learn, I'm probably 50% fluent in medical Spanish. I have 3 bilingual staff. If we truly are about a commitment to care and access and service, then we have to serve everyone. The only reason that I care about your insurance is that, a Medicaid may cover one medicine and private insurance may cover another. But in terms of when I walk into a room, I'm not going into a room to say you're a Medicaid patient. You're a child who deserves to be valued, loved, appreciated, and you need to get the 110% out of me every day. So I will tell you, I agree with Dr. Richards. I think one thing that I'm very appreciative of, in my job is the joy and the feeling of making sure that any child receives the best from me, knowing that in other situations, they may not receive the best. That's what they deserve. That is, to me, what my divine purpose is and why I enjoy being a pediatrician every day. And so, money can't be everything. I think at the end of the day, if I can make a difference in the life of the child, then I'll let my work speak for me.
Awesome. Thank you so much for that. I think Dr. Roberson broached at the start the tension or the difference sometimes in patients that look like you versus providers that don't necessarily look like the patients that they serve. Have you ever had an experience, and I think everyone could probably take a stab at this, where a colleague, a mentee, a patient, someone you're aiding looks like you, and they make the comment or something in the vicinity of, oh, you're brown like me, or you're the first Black woman dentist I've ever seen, or you're the first hospital administrator that looks like me. Have you ever had those moments, and what has that meant to you?
Well, for me, it meant a lot early in my career. In particular, I was running a facility in Mechanicsville, Virginia at the time. And I was I think I might have been the only African-American licensed nursing home administrator in the state at the time. And I was a pretty young person. And the staff really responded to me, mainly because I looked like them. And I was, communicating was fairly natural. It was a really a rewarding experience, particularly those years when I was doing operations work. You really do get to connect with the staff, understand the staff's perspectives, and not only what you have in common, but what's different, and a lot of the challenges that our direct caregivers had. I mean, from, like you said, transportation to work, and those kind of things in snowstorms. And I remember going to Creighton Court with a van to pick people up to come to work. And it was, again, just an experience for me, really to grow and kind of understand where people were coming from. So I think there's always this element of connectedness that we can offer the folks that we serve. And, I found that you had the ability to kind of tell a different story and tell your own story, which for them is oftentimes encouraging. They can see that, this is what I do, and this is how I got where I got. And I think it's inspiring. And I know for me, I got inspired many a times by the work that they do as well.
Thank you for that. Anyone else want to share around that point?
I tend to get that a lot in practice. Like a lot of parents they see it. But the thing is, where the practice I'm at, and I'm in a place where I never thought I would be when I was in school. The other dentists in the practice are Black too. So honestly, there's 2 other Black dentists, and we're both all around the same age. And then my boss is from Peru. So you're getting a woman of color no matter what you do at our office. So it's but it's very rewarding because our parents and our families really respond to it. And I love seeing teenagers light up when they see someone that looks like them and they tell me they want to be a doctor or a dentist. And I went through the guaranteed, did my bachelor's at VCU as well, and I was a guaranteed admission student. So I got into dental school 2 years early. Got my admission. And so I will stop and show a teenager how to do it. Like, this is, look at these programs. And I just push them so much when I see kids that look like, I get excited when I see them, probably more than when they see me. Mm-hmm.
How about with pharmacy at all?
Yeah, thank you for tapping on me, Dr. Smith. So I will say I've never really had any role models in healthcare, and that's because when you look at me, you might think I'm ethnically ambiguous, or I've heard a lot of comments growing up in Virginia saying I'm just exotic, when I just feel just as good as American as everyone else. And just growing up, a little bit of background about my family experience. My parents are refugees. They're genocide survivors. They've seen a lot of death. They came from a country where they were trying to establish themselves, and then to have to assimilate to a new country and to learn a new language, and to basically start from scratch, working in jobs that were way below their educational understanding. But I think when you're an immigrant, you don't have that a gift or ability or privilege to participate in in higher education, you kind of have to start from the bottom. So there's a general like lack of seeing people like me or went through what I did to know where my path was. So my journey, I really didn't have as much support or understanding. My support was like my parents who didn't understand or how to navigate American higher education. So I relied heavily on my public high school counselors in finding the right pipeline program to take on students from underrepresented and socioeconomic backgrounds. So I'm very appreciative of the opportunities and the pipeline programs that VCU has offered. A couple people that are joining tonight, I recognize them from when I was 18, and they were helping provide that ground for me to do that. But when I do see someone, maybe they're not Cambodian, but they're part of that trauma or from those families or lines of trauma from Southeast Asia, where we did have to go through seeing our parents go through a lot and struggle, and also the stigma against depression and mental health discussions, and just navigating education system. I do reach out and try to help as much as I can, because I definitely understand and empathize how challenging it can be. So when I look at role models, I do often look at other prominent leaders who have gone through so much, and they end up being a lot of prominent Black medical professionals or social justice advocates. So those are kind of like my mentors.
Awesome. Thank you so much for sharing that, particularly, the very vulnerable nature of that with the group. You lead us to a interesting path around the fact that there are all these barriers for folks who are othered, who are minoritized or historically marginalized, or how whatever word we want to use. But there are all these racial barriers, really, right? For folks of similar backgrounds. You talked about not really having a mentor to look to. Can anyone speak to that as well as their pathway, or the importance that a mentor was for them, or other strategies that you might have used to overcome these really entrenched barriers that do exist?
Yeah, I was going to say real quick, mine was Dr. Tony DeLillis at VCU. He was my faculty advisor, Italian, sort of, I call him a former hippie, maybe a little bit, back in the day, maybe in his younger years. He ended up retiring from VCU's nursing school. But Dr. DeLillis was an incredible voice in my life, and we still stay in touch to this day. He's the one that said, I can do this. He was the one that encouraged me to pursue the path that I was on. And, a personal story, I couldn't get a job when I graduated from school. And at that time, everybody got jobs, everybody. So everyone had jobs 6 months before they graduated. It was such demand because the senior service business was growing so fast that, there was just this huge demand for leadership. And I had some of the best grades in my class, and I mysteriously couldn't get a job. And lots of experiences as I worked through that process. But I was naive enough to think that they just didn't want me for, whatever reason. And I'll never forget him grabbing me by my shirt collar and saying, this is called racism, son. And I am going to spend full time, all of the time that I have to make sure that you get placed because you deserve it and you're qualified. And don't think of it for anything other than it is. And for this reason, you have to do what you do. And that changed my life. It helped me to see the world for what it was. And it was heartbreaking for a young guy starting his life. But at the same time, it gave me a dose of reality. And most importantly, I did end up getting an opportunity and things ended up working out. But again, it's not, the person doesn't always look like you. Sometimes there are folks that don't look like you that actually invest in you. And he did. And I'm eternally grateful for that.
I think that's so riveting, that you share one that, you know, the person may not look like you, but his, there was no hesitation for him to call the issue what it was, right? And I think even in all of our DEI efforts and all of our inclusion talk, not just at VCU, but across the educational landscape, across any organizational landscape, whatever entity or field you want to think about, I think there still is some hesitancy to sometimes really name this thing in what it is, you know, around, or, you know, a lot of the political fodder that has risen or gets thrown around when we, you know, call something systemic racism, right? Which the American Public Health Association, the American Medical Association, all of these things have named entities. Recently, the CDC has named racism as actually a health issue. But we're still teetering around that in some instances, right? Dr. Roberson, did you have something you wanted to share around, you know, strategies and overcoming the different barriers that have been in your path?
Yeah, so similar to our previous panelists there, a number of my mentors have not looked like me. They've not been African American. And I'll tell you, I'm very grateful for each and every one of them. One of my main mentors, she has passed on now, but taught me an unbelievable lesson when it comes to leadership and professional development. And prior to her entering my life, I didn't know what a mentor could bring to a relationship. Let's put it that way. So that was just not part of my upbringing of being mentored. But now I have actually sought out that opportunity with others and have offered to mentor others. I also had the great pleasure, and I was blessed to be mentored by an African American leader at VCU Health System. She was really on the cutting edge, I would say, in our organization as the first African American nursing director. And she had to pave the path as an African American manager and then director, which at that time was truly unheard of. I did not see that in my practice. But she really took me under her wings. And she was, as I mentioned, I was not born and bred in Virginia, and she was. So she talked to me about things such as St. Philip's Hospital, which was the original School of Nursing. For many people who know about that, that was the school where African Americans went to become a nurse, because you could not go to VCU School of Nursing. You could not practice at MCB at that time. So she was born there. So I got an unbelievable learning lesson from her about that. And she talked to me along the way about being a leader, and how I may have to carry myself a little differently as an African American leader, but nonetheless, always as a leader, first and foremost, and as a human being, and being prepared to serve others and to be willing to give that service to others as the need arise. So I've taken those lessons along with me in my clinical practice, in my bedside practice, as well as my leadership. And I think it has served well. I had to chuckle earlier when you mentioned something about, have you had a situation where someone, when they see that you are who you are, you know, the pediatric dentist and whatnot, I wear a badge and it says nurse scientist, because everyone at VCU in nursing, you wear a badge that identifies your clinical title. And people are constantly always asking, you know, well, what's a nurse scientist? And I tell them that I went back and received my PhD in nursing. And the looks and the comments that I get, it does make me proud, because I know exactly what I and many others had to go through to complete a rigorous PhD program at VCU, especially in the School of Nursing. But it does make me proud, but it also opens up that door for my 3-minute elevator speech to tell people, you know, I'm just one of many. You can do this too, and you can achieve whatever goal you set forward. And I try to surround myself with a lot of positive people that just inspire me, regardless of their ethnicity.
Thank you for that. You know, you mentioned St. Philip Hospital, and I think, especially because this program is lodged within the overall history and health racial equity programming that's happening. I think sometimes people can get a little bit sidetracked with wanting to know, why do we keep talking about the past, right? Why is it still important to name these issues or talk about even, in some of our professional organizations that Black folks weren't allowed to join until the late 60s or early 70s in some regards. Why, in order to move forward, do you think it's important to really understand these historic, I'm also an ethicist, in addition to being a clinician, what I would say these ethical lapses, right? When we talk about that book Organ Thieves, when we talk about Henrietta Lacks, when we talk about all myriad of issues that are these historic things, why is that still important to talk about today, you think?
Well, I tell you from my experience, again, and I think this may be true for other panelists, I see a very fairly diverse patient population in my unit, and I have a very older patient population in my unit that have chronic diseases. And so they do tend to return to the ICU setting. And there's still, a great deal of history and stigma that's attached to the care that they receive and the trust that they have. Just this COVID situation and people wanting to get the vaccine. You just will not believe the number of people I've talked to, be it in my church, be it at work. There's just a lot of mistrust that's out there. So I think we actually will create more mistrust if we don't talk about the past, but I do try to get people to understand, don't allow that to paralyze you in your thinking and to propel you forward in your thinking. Because there are just amazing practitioners and people out there, and they are forward thinkers and trying to move forward. But we don't want to forget the past. We do want to learn from it, and we do want to make things better. But I don't think trying to hide that, and I think the transparency, as we've just seen in the last 24, 48 hours, just on the media, it's really important that we are transparent. And people will not like maybe some of the outcomes on some of the decisions, but I think it's just so important because we have people in a history, especially in Virginia, where it has not always been so transparent. And in healthcare, it's not always felt like it's been transparent. So being upfront and having those discussions about the past and where we're going in the future and how we all get there and do it together, I think is extremely important.
That's so great. And I'd be remiss if I didn't say, this is communal mistrust that was well earned, right? I think sometimes we think that this mistrust, like there are these fables of fancy or something that we're now starting to prove little points along the way. But, even like the organ transplant or Henrietta Lacks, these are things that don't seem all that out of character because it was much more common than we realized. I think Dr. Freeman, you had maybe a point around history and how that overcoming these inequities and is connected to history as well.
I just want to piggyback on what Dr. Robertson said. I've been reading a really awesome book by Benjamin Campbell called Richmond's Unhealed History. And it really goes into a detailed analysis of just over time in Richmond, almost from colonial times, some of the integrated systemic racist policies and practices that really created some of the things that we see in Richmond today. And I think not only here, but across the nation, I think, we don't want to totally just focus on the past unrelentingly. But, I'm always the kind of person that says, if you don't know your history, you're doomed to repeat it. And so I think it's going to take some great courage, I think, from all of us to have some significant conversations about race, about equity, about access, and not just in healthcare, but in the social realm in terms of policy. I think we have to do it in a spirit of love and kindness. I think it's going to require all of us to be very empathetic, be vulnerable, and kind of give people a moment to kind of express some of the things and endured damage that has been done over the years in terms of a very wide range of areas of our social structure. And I think the only way that we're going to be able to move forward is have some of those conversations. I think many times we just don't have the courage and the wherewithal to have them. But I think when you look at Dante Wright, when you look at George Floyd, I think, you know, a lot of people, we talk about COVID, and I think, you know, I always believe something as a blessing and a lesson. And I think, you know, we focus so much on the medical side of COVID, but I think what COVID has done in terms of trying to, you know, be safe and isolate ourselves in our little, you know, social corners, I think it really has brought to light a lot of the inadequacies and the inequities in our social structure. And so I think what we need to do is really have that step forward moment to address some of those issues so that we can move forward. And that means not only, you know, have those conversations, but try, as Dr. Robertson said, the hard work is going to be after the conversation, taking those conversations and implementing the action, whether it comes to the issues with voting rights, social justice, making the policy changes that are going to make a more equitable future.
Awesome. Thank you so much for that. You know, you bring up Dante Wright, and I guess I'll take the charge, since this is not the question that was on the sheet, but I'm gonna go with it. You know, when we talk about collective trauma, right? We're on the heels of still George Floyd. We're on the heels of all of this discussion around anti-Asian hate, right? And the AAPI community, you know, supporting racism against our AAPI community as well. What does it mean to you as a healthcare provider, in whatever space you're in, to collectively be continually inundated by racial trauma? These traumas that play out on social media, that play out on the news, the fear that it elicits, being misperceived, or if you don't have that badge on that identifies you, could something negative happen? Talk to me about what it means as a healthcare professional rather, to come in and still do your job the next day, or to hear the news about the Derek Chauvin trial, or whatever the latest issue is, that the young man in the military that was right here in Virginia that was pulled over in a very obscene fashion. What does it mean to still show up to work the next day, but kind of have that weight on your shoulder?
That's a loaded question. I will just start off. I'm no expert, but I just wanted to include on top of that, you know, part of me was a little bit, it is really hard because we don't live in a vacuum and our communities don't end at the door. But also in this week where there's just so much injustice we see here, on Monday, I woke up seeing a European freelance artist take the images of victims of the Khmer Rouge genocide that is displayed in one of the memorial museums. He took their faces and redigitized them and colored them and totally redistorted their faces so they were smiling in their last moments. And everyone was, it was a very shocking thing for me, on top of what we see, to just know how much it probably re-traumatized families. And he did not ask permissions from the victims of the families to do that. And in one part, you always have to give that grace. Maybe, you know, with love, maybe he wanted to memorialize these victims before their last moments for their families. But upon research, it was more just for his own self-promotion to show how he could redigitize photos and kind of get his name out there. And it was published on Vice, kind of applauding him for humanizing these victims. And it was a very hurtful thing, on top of hearing Dante Wright, upon hearing what happens right in Virginia where you live, where I feel like I grew up. And on the heel of that, you know, this week was supposed to be a very happy week. It was supposed to be Cambodian New Year. And so to me, it's like so many black clouds of happiness. And I think, and I can be very sensitive too. Like I can think about this and be like, oh my gosh, like doom and gloom. So there's a podcast I listened to that says, you know, we really have to learn how to balance the fear of what we see and try to balance that out with our hope and our perspective and what we can do to know that this is not the end all be all. But it's very hard to feel like the world is against you. But I've been very strategic in how much I ingest the media, because it's very hard. You can't have your TV up listening to this while you're practicing or while you're working. So it's like I have to be very strategic. You know, I subscribe to like the skim, so I can read everything in 10 minutes and move on. And I have to block that out and leave everything at the door. I've also subscribed to one about Southeast Asian refugee activism in the community, because, you know, I don't know anything more than you guys. I'm still learning all these resources. So they give a great digest of what's going on with these topics. And that's kind of how I was able to formulate even the words to say about what happened to Khmer Rouge, because I was just so upset. I was like, I can't believe it, until someone put the words for me to say, like, this is not right. Because sometimes I'm like, what? And, you know, have all that. But like I said, I'm definitely not an expert, and I definitely like to invite the other panelists, like how they handle, you know, all those things that happen outside of our work.
Thank you so much for that, Dr. Kopp. You are an expert in your experience, right?
Absolutely.
I really want to see, how do others navigate this? Because I think it's so important. Even I think the National Academy of Medicine has talked about resilience of practitioners, right? And how our even ideal patient outcomes and patient well-being is connected to provider well-being, and provider well-being does not take place in a vacuum. And we have all these cultural pressures and outside entities or the stressors of this kind of racialized trauma. How do you guys encounter that? I think some of our colleagues that might not look like us, that are very well-intentioned, it's not a burden that they carry or are necessarily faced with. So I think it's important to digest this or dialogue about this a little bit. Anyone else want to share that feels comfortable? How do you move forward even carrying that trauma?
Oh, go ahead, Dr. Oh, I would say that it is hard, especially being you know, a clinician, you know, like most of us, like we all are. So, and you have to talk to everybody, and then working with kids, you have to be happy. So it's it's really hard a lot of times to pull it together. I remember one of the trials ended the week my residency started in 2018. I honestly can't even remember which one at this point. It's been so many. And I went to school and it was just so hard. And I got out my car and it was like, I just don't even want to sit in class right now. And I happened to get into class. One of my co-residents, she was white. She's from South Carolina. She was already crying about it. And so I have to say that was probably one of the things that, you know, being in my residency program, in dental school was hard dealing with that type of thing. But being in my residency program and having that support of people who were, who could empathize with the things that were going on. And then now being in the environment I am in now, where most of the people that work at the office are Hispanic or African American. So I feel like being able to have that surrounding of people who are kind of feeling the same thing, we kind of are able to support each other in that, and we can go to work and we know we can talk about it. I think that that's like beneficial. So no, it's not a kept secret, or no one feels like they can't discuss politics or the news and things like that. It actually is something we can discuss and wear on our sleeves sometimes. So I think that that's been pretty much a big benefit to like where I am right now. I will say a lot of times it does kind of, I don't know how it makes other people kind of like, you know, view me. I don't know how, I know a lot of times I feel like I suffer, and I would, with Kellyanne, sorry if I pronounced your name wrong. I have pretty much the same issue sometimes where it's like, I don't believe that I can be like, I am an expert at where I'm at a lot of times. And so you get that imposter syndrome a lot of times. And so I feel like sometimes having all those emotions, those negative emotions for things happening in the news and happening to Black people, and it's being treated subpar, it's like you feel like, you almost sometimes feel like maybe I'm not where I'm supposed to be. So it does have a big impact on like how it feels some days, but I feel like I can talk about it a lot of times at work.
Anyone else willing, interested in sharing around kind of that point?
Yeah, I was going to say for me, I think, particularly being here in Washington, D.C., I live in Alexandria, and I do a lot of lobbying work on health policy on Capitol Hill, and obviously the recent insurrection. I'm a native Washingtonian. My family's been here 5 generations. I'm from the chocolate city. That's what it's always been. It's not as chocolate as it was when I was growing up, but this is the city that I come from. And it was really interesting, though. You have a dialogue about, and I'm not, I don't say, I struggle sometimes with the trauma word. For me, I come from an era and a generation where, my grandparents experienced trauma, and I sat at their knee. And it's not to say that we don't, and not to say that we're not now. So there's no minimization necessarily of the current experience, but at the same time, I definitely had sort of firsthand reminders of sort of what the system openly was like. And this experience, though, shook me in a very different way. Seeing a Confederate flag march through the nation's capital, and then really processing the fact that they got in. Like I go in there every day and I'm greeted with an M16 and what is your business here, sir? So, and I'm suited up with a tie and I'm there on business, and they treat everybody that way. So it's not like particularly easy to get into the Capitol. So to see all of this unfurl in the manner that it did, I think did traumatize me in some way, if I really want to admit it, because one, it's my hometown, and to me, the nerve of them to be in my city hurling that flag, but then on top of that, to walk through sort of the sacred place that we call our capital was pretty traumatic. But I think as it relates to tools, I do just try to remind myself of a lot of the things that my grandmother told me. And my grandmother told me this world is ugly and you have to accept that. But you have to be the change in the world. And you've got to go out there and make the difference. And, and I guess, unfortunately, I've accepted that reality, and I'm not as shocked anymore when I see these things. I'm just disappointed, and just try to make the difference that I can.
Thank you so much for that. I know we're over our time. We're supposed to go to our breakout rooms, but I don't want to transition. If Dr. Freeman or Dr. Roberson wants to share around this collective point, we'll certainly take the time to do that.
I just wanted to say real quick, it's made me think a lot about my children. I still call them children, but they're in their late 20s. And my kids have come to my husband and I more than I care to count right now over the last, probably the last year, with all of the Breonna Moore, George Floyd, we can go on and on, even Trayvon Martin. And that's been very different and interesting for me to really, really listen to what they are experiencing, and how they perceive what's going on. It's a lot of, when I listen to them, it's a lot of right and wrong, but they don't see the racial barriers that perhaps we have seen historically, because they've grown up with having predominantly Caucasian friends or non-African American friends. And so they just seem to think that there are bad people out there, but not necessarily see that some of those people are people you may even be around. So that's just been an interesting discussion my husband and I have had to have, and I think other men can also relate to, when my husband had to have that conversation with my son, that broke my heart, about growing up as an African American boy. It just truly broke my heart, and I know it was something he had to do, and something that he did not look forward to doing, but it's still today something that I know our African American men have to do with their sons. And the conversation I have to have with my daughter is slightly different, but nonetheless a conversation that needs to be had. You know, the only other thing I want to say about just where we are today, I think we have just barely scratched the surface when it comes to having these conversations. I'm glad we are, and I'm glad we're doing that, but I have to just, in my opinion, in my area, we have barely scratched the surface when it comes to patients and patients' access to certain care. When I think of when people talk about transplant surgery and having access to transplants, when people talk about having access to hospitals in certain trauma settings and urban settings versus out in rural area, I think we have just scratched the surface. But I am glad people, and I know part of the introduction was that, yes, I did receive the first COVID vaccine at VCU Health System. That was definitely not my plan. And I have to be very honest and transparent when I say that I was not planning to get the vaccine. But the week before the vaccine became available at VCU Health System, I had an unbelievable aha moment. In my unit, we had lost a lot of patients that a year ago we should not have lost. And that was a turning point for me, to have to go home and tell my family and just talk to other colleagues about what we were seeing in that unit. And that was the very beginning of me saying that I was going to do this. It met some resistance with my family because there was a lot of uncertainty. But I went and did that, again, not trying to be the first, but just deciding and making up in my mind to go ahead and do that. And I think one of our panelists mentioned, I'm not trying to be Sojourner Truth or anybody like that, but we do have to put our money where our mouth is, and we have to step out on faith. If that's what works for you, that's what definitely works for me. And to be that role model, you never know who's watching, and you never know who's listening. And so it's been amazing, this journey I've had, since December when I first got the vaccine. The number of people that have come to me, people that have emailed me that I have never met in my life, I probably will not meet. And all I hope and pray is that's been a blessing for them to see that I'm still here. I still have 10 fingers and 10 toes. I didn't blow up, but that it is the right thing for us to do. Now I'm going to have to work even harder, unfortunately, now with the whole Johnson & Johnson stuff, but it's still the right thing to do. And sometimes we just have to, like I said, step out on faith, and you be that role model. Don't be looking for somebody next to you to do that.
Carlos, can I say one thing before we go to the breakout room?
Go ahead, close it out.
Just to piggyback on what Cliff or Audrey just said, being a Black man in America is hard. I can't speak for Cliff, but what I will say is that I know that the conversations, as Audrey mentioned earlier, the conversations that young Black men have with their parents are different than other people. There are certain things that your parents have to prepare you for. My mom used to tell me all the time, the signs colored and other may be down, but the signs really are still up. From a sociological standpoint, I really feel like, as Cliff pointed to, I can never think about the trauma that people like my grandmother, my great-grandmother, and many generations behind me experienced. I think that those incidents were more on a macroscopic level. I think now in some of my years, I think they've become microscopic. I think, in the microaggressions that I experienced when I had professors in college and in medical school who didn't think I was worthy enough to pursue a certain curriculum. I think we've seen a change now over the last 4 years that I think, we see a return to more macroscopic pressures and stressors in our society. And I think it's going to really take all of us to work together to move forward in an honest way. I think there are going to be some very difficult discussions moving forward. And I think it goes back to my earlier thought about we've got to have a conversation about the past and our history. And we've got to resolve that and clear that out so that we can move forward in a positive way. because of some of the conversations that my parents had with me, some of the things that I see on television, I've been prepared for them for a while. I've been told to be prepared for things, to keep my hands on the steering wheel when I get pulled over, to act a certain way as a Black man. So those things have been ingrained in me as an African-American male. What I will say is, I think many of us on this panel, as an African-American, faith and the church are, I think, a critical cornerstone, I think, of Black society. And so my faith really helps me get through some of these times. My spirituality is very important for me. You know, I always believe, as my pastor will tell me, walk by faith and not by sight. I have to believe, as an African-American Southern Christian, that God is more powerful, that God is in control, and that everything works out for our good. And that we have to take all of the experiences and take advantage of them to have those difficult conversations. I think they are beginning to occur. Like Audrey said, I think we're just at the tip of the iceberg, but I think the hard work is upon us. And I think what I do every day when I see these situations is it only gives me more resolve to work harder to make a difference. And so it's not that hard for me. If my grandmother and my great-grandmother can deal with Jim Crow and deal with disenfranchisement and deal with other issues, I owe it to them as being my ancestors' greatest dream, that I just have to carry my cross and go with it. That is how I act as a Christian. That is how I act in my everyday living. And I'll stop there.
Thank you all so much. This has been too brief and so rich. I will just say briefly, you know, the tough conversations, if I could put my Southern preacher alliteration hat on, we can't heal what we don't reveal. And so we have to open it up and let the wound have some air in order to move forward. And I think this is a step in the right direction. Thank you so much for this conversation. Thank you so much to our panelists. Thank you for everyone who signed on and engaged with us. Thank you for those of you who are going to meet us in the breakout rooms as well.